Tinnitus is when you hear a sound in your ears that no one else can hear. And this is what we call subjective tinnitus, meaning that you're hearing a buzzing or ringing or other noises in your ear. Sometimes you can hear a pulsation in your ear, and such as a heartbeat in your ear, and that's something to discuss with your doctor as well. Tinnitus is caused usually by damage to the inner hair cells deep within the inner ear that are microscopic. And a lot of times what happens is that you have hearing loss related to damage to the inner hair cells over time, which could be from aging, from noise exposure, especially if you work in an industry that's exposed you to loud noises, from shooting guns. It can also be from other types of infections. There are some inner ear disorders like Meniere's disease that can cause ringing, but often it's because of hearing loss. And so the reason that you end up going to the doctor when you have this noises that only you can hear in your ears is to make sure you don't have hearing loss and for us to evaluate you to see if there is a treatable cause of tinnitus. So oftentimes when you come into the otolaryngologist, the ENT's office, you're going to see the doctor, such as myself, and you're also going to get a hearing test. So you'll be evaluated to see if you have wax in your ears that could be obstructing your hearing, causing the ringing, whether you have fluid behind your eardrums from allergies or after a cold or sinus infection. And then you'll get a hearing test to see if you have hearing loss, often nerve-related, that can cause the tinnitus. The treatments for tinnitus is to look for anything such as Meniere's disease, or sometimes even if you grind your teeth at night and clench your teeth in your jaw joint or temporomandibular joint is inflamed, that can cause tinnitus. High doses of aspirin, Motrin, Aleve can also cause tinnitus, as well as caffeine. But typically it's because of hearing loss. Often, if you have significant hearing loss enough that you need hearing aids, 70 to 80% of people who wear hearing aids will see a significant improvement in their tinnitus over several months. Other options for treating your tinnitus would be noise masking, where you keep radio, TV, or music on in the background, or have a white noise generator or play a sound of the ocean in the background that will help calm the brain down and keep it from producing as much of this tinnitus. Biofeedback or cognitive behavioral therapy are some solutions. There also are specific types of, almost like a hearing aid called a tinnitus master, that can pump white noise into the ears to help with this as well. But if you have significant tinnitus, especially if it's only in one ear, I highly recommend that you see a physician to get this evaluated. There is one specific type of tinnitus that is very common. It's called transient ear noise. It's where you'll have ringing in your ear for less than a minute. You may feel a faraway sensation in your ear and lose your hearing briefly, and then it comes back. That's something that's common, that happens to a majority of the population. It's not something that we get concerned about. Significant tinnitus that lasts for 5 minutes or more, and chronic tinnitus is tinnitus that lasts for up to 6 months. So if you have any of those, please seek medical help and see your physician.